When you say a long time, what sort of time frame between treatments? Are you talking years, like?
Usually 12 months or more.
Oh,
So if somebody had a Braxton, had a fantastic response, it again depends on a lot of things. Like I might give somebody a chemo, cancer never shrinks. Then I know it probably won't work well the second time round. But I gave somebody chemo, the cancer shrinks by 80% and then remains in quiet for another 12 to 14 months and then it comes back again. Then I know this chemo is more likely to work than the one which it didn't shrink at all. So it's also dependent on response to treatment.
And so it just outsmarts, it's like it mutates to find a different way.
Yeah. Just to give you, and I don't know if you all believe in God or not, but the way I see it is the system that's been designed by God is far more complicated for us to understand, and we are just at the beginning of understanding. When first the genetic analysis in the molecular biology and all got tested, everybody got so excited 15-20 years ago. We're going to find out all the gene, all the DNA, everything, and we'll know each cancer, each disease and fix it. And then when you realize it, you realize the permutations and combinations and the probabilities are more than the computing power of the whole world together. So we are beginning to understand. Obviously there are certain cancers, like just to give you an example, I don't know if you've heard, Gleevec, CML, these are one cancer, one gene, one abnormality. So you block it, extremely good result. Herceptin, again, it's a game changer in breast cancer with HER2 positive. But not in every other cancer. 80 to 90% of cancers we treat are not like one gene, one cancer. They are multiple gene complex interplay in a cancer.
Wendy, you had a question?
Yeah, the balancing of the quality of life and the quantity of life. At what point do you say, or do you say to the patient, or do you listen to the patient says to you, I can't keep doing this, I've had enough of this treatment, I'm finding now my good days are fewer than my, but used to be I had quite a few good days and a few crappy days. Now I feel that I've got more bad days or crappy days than I have good days. But my doctor's saying, oh, there's this coming and this is coming, and I feel like, I've got the donkey, the man on the donkey with the carrot being tangled in front of my nose to sort of keep going.
So Wendy, all I would say is every oncologist is different. Some are more aggressive, some are less aggressive. Just because I'm an aggressive oncologist doesn't mean I don't listen to my patients. My style is different to, say, any other colleagues of mine, and their style will be different, and we all feel differently about different things. But I pay a lot of emphasis on the quality of life. I feel at the end of the day, if there is a treatment that can fix that cancer or the problem, I am prepared to cause a short-term drop in quality of life for a long-term gain. But eventually, if I can't fix it, then I've got to balance the quantity and quality of life. So I always constantly work with my patients and talk to them about holidays, things and that, give them hope. But you can't have a general rule for every patient. I have patients who don't want to talk about the end. Like there are patients who know it and don't want to talk about it because denial or ignorance is their coping mechanism. There are patients who want absolutely every detail because then they can plan, that's their coping mechanism. There are patients who feel anxious every time I tell them, no, your chemo is finished, let's put you on hormone and see how you go over the next few months. And they say to me, Vikram, I feel very anxious going off the chemo because I've been on chemo for the last few years. And there are patients who say to me, I've had enough, I want to cry. So it's a constant dialogue between the patients and the oncologist, and my practice is very transparent very often. But obviously, everybody has different styles, and I consistently balance these two. And I'm a very big proponent of quality of life. But one thing which is very important is your quality of life is maximum when your cancer is lowest. And as your cancer gets more resistant, it will go down. So sometimes patients think that their quality of life is being dictated by the treatment, but that may not be the case. Your cancer gets worse, you get short of breath, you end up in hospital, you get pain, you get bone pain. So that's not your treatment, that's the cancer. And over time, the quality of life will go down because of the cancer. As your cancer gets worse, you've got a lot of disease in the liver, your appetite goes down, you've got a lot of disease in the lung, you get short of breath, you're on a lot of painkillers, you get tired. None of that's to do with the chemo. So the cancer also dictates the quality of the life. And it's trying to be a difficult situation to try and work out. And that's what I feel my role is, to I am not somebody who imposes and says this is what you need to do. I'm saying like, look, this is the situation we are in. I think this is what we do. What do you think? And that's, again, everybody has a different style. And if somebody is making an absurd decision, I would very strongly recommend them not to. But if somebody wants to delay chemo for a month and their disease is well under control because they want to have their 60th anniversary, I don't mind. So it's a constant dialogue, but your quality of life is also dictated by your cancer, and that's a very important piece to understand. And it's as an oncologist, it's my job to work out where quality of life is more affected by the treatment and more by the cancer, and that's the balance. Some women I would say, look, I think we should keep going because I'm very worried if I stop your treatment, your cancer is going to get worse. And sometimes when the cancer gets worse, it might get worse like this, and there may not be any coming back. So that's the other issue. We are always worried about it. May not always be like this.